Good afternoon, everyone, and welcome. We start today by acknowledging the traditional owners and custodians of the lands on which we meet across Australia today. We pay our respects to their elders past, present and emerging. I'm joining you today from Wurundjeri land in Melbourne. Sovereignty has never been ceded. It always has been and always will be Aboriginal land. My name is Angela Jackson. I'm National Deputy Chair of the Women in Economics Network, and I would like to thank all of you for joining us today and sharing your lunch with us for the latest in our series of joint Women in Economics and Economic Society of Australia webinars on the implications of COVID-19. What about the children? Now, we all know that COVID-19 and the resulting society-wide lockdowns have, in macroeconomic terms at least, been a shock. And they've catapulted the economy into its first recession in 30 years. But for us microeconomists, even more importantly, it's been an exogenous shock, which will have measurable implications for the life trajectories of everyone it's touched. But these impacts will vary across gender, socioeconomic status, and what we're here to discuss today, age. So today we aim to explore the impact on children of COVID-19 and the resulting recession, and explore the policies that may help mitigate or amplify these impacts. Now, we've had the help in the lead up to this, a fantastic team, the Economic Society of Australia, including Sue and Di, and we've brought together an expert panel. We're having a few technical issues with that panel today, but we've got two of them sitting with us ready to go, and hopefully a third joining us shortly. Hopefully Annette Lancy will be online soon. She's currently heading the Victorian Department of Health and Human Services COVID-19 Planning and Coordination Office, which has been set up to deal with the implications of COVID-19. In previous life, she's worked across Access Economics and as an economic advisor to two Prime Ministers before she forged a very successful career in the Victorian Public Service. Professor Schurer is here from Sydney University, where she focuses on the economics of human development, including the impact, importantly, of public policy on human development. Julie Sonnemann, we're very lucky to have here today. It's been a busy day for Julie. She's a senior fellow at the Grattan Institute and authored a paper which was released today on addressing the education losses due to COVID-19's lockdown. Now, we're aiming to make today's discussion as interactive as possible with the limitation of my IT skills, and I'll do best. And so we've got questions opened in the Q&A. So if you have any questions for the panelists, please feel free to identify yourself in those questions and to post them in the Q&A section on the Zoom. And I'll do my best to direct them. So we're going to start today by discussing the lockdown and the impact of staying at home. So Julie, I'll start with you. There were a lot of arguments, particularly I noticed on Twitter, like it got very heated, about the impact of school closures, particularly the impact on disadvantaged kids. Do we have any evidence, and what did the evidence leading into the lockdown say about this?
Sure. So we've just done a review of the evidence around this, and what you find is that during remote learning, disadvantaged students definitely do a lot worse. And equity gap is known to widen during that period. And potentially some of the most relevant literature on that comes from it's a thing called the summer learning loss, which is a phenomenon that's pretty well known in the US. And basically it shows you that when kids are at home over the summer holidays with their parents, disadvantaged students actually come back to school forgetting what they'd learnt the year before. Yeah. Whereas advantaged students don't. And so it really shows what we've known already, that the home influence on student learning is the biggest factor outside of the school. And so we're expecting for states that have had remote schooling periods of about 2 months, that disadvantaged students will have slipped back by about a month over that period, which is, and obviously that's assuming, that's in a good case scenario. In a bad case scenario, depending on the quality of the schooling that they've received, they could have learned nothing, is more than likely what our estimates are showing. So it's quite a bit, but what our report's also emphasising is that this is on top of a really big existing equity gap. Yeah. So this is really just compounding the big inequalities that already exist.
What were the size of those inequalities coming in? So if we're talking in an extra month, is that, proportionate, was it?
Yeah, so if you look at it, for a year 3 student, they're typically about a year. Disadvantaged students are typically about a year behind their peers, and by year 9, that's 3 years behind. So actually,
Okay, wow.
in that context, losing a month of learning is not that big a deal. But if you think about where they already are at in their learning, the likelihood that they'll recover that anytime soon is very, very low. And this is actually, now we've just had this political spotlight on schooling in the home. There's like good community will to do something in this space. So it's a good opportunity to try and address inequality in our view.
Yeah. Steffi, in terms of that sort of month gap, is that big in an economic sense, or is it, compared to that sort of 3 years that was already there, it's sort of insignificant and we shouldn't really be worried about it? I think you're on. Yeah. Sorry, we've just got a problem.
Yeah, thank you. All right. Hello, everyone. Thanks for giving me the opportunity to talk today, and for the 788 attendees who are joining us today. So I'm of the view that these learning losses that we're going to see as a result of the lockdown are rather negligible. So I'm one of these economists who say maybe we shouldn't panic about this too much, particularly the learning loss, because I know there are socioeconomic inequalities in this, but it is going to happen throughout the board. So this is going, like, all the schools were closed. Some schools were more prepared for continuing with the online instructions, where other schools were not so good in using virtual methods, even private schools who didn't manage to do this well, to keep up a face-to-face relationship with the teachers, with the students. So I think in this case, it would be possibly better not to panic over this 1 month learning falling behind. But there are concerns over what is happening in the home, right? And the very famous Hart and Risley study from 1995, which had shown that children from very disadvantaged backgrounds, by the time they're 3 years old, they have like a deficit of 30 million words that they have heard in the home.
Wow.
If you stretch this over 3 years or so, then you probably would be very concerned, because the home environments in very disadvantaged backgrounds may not be conducive to pick up this learning loss. So I personally think a 1 month loss may not be so much, but you could be considering the habit formation problems that happened during the lockdown. So lockdown, schools were closed for 8 to 10 weeks. Some kids could go. It was not a 100% lockdown, but you could think that maybe this changes the habits that these kids are having in the longer run. And we have some very positive findings from the Northern Territory in very remote areas, and for Aboriginal kids that go to school in very remote regions. And we know that if kids are induced to attend preschool more regularly, and some of you may know this, that school attendance is the big thorn in the eye of the public policymaker in the Northern Territory, because school attendance rates in remote areas are only 66% on average among Aboriginal children. And so policymakers always try to get these school attendance rates up. And we see that if you induce attendance in preschool, you also increase attendance by a certain amount in first year, year 2, year 3, and so on. And any school achievement gains that these kids have are entirely explained by higher school attendance. So in extremely disadvantaged areas, a loss of 2.5 months of going to school may mean that this habit gets lost again, of attending school regularly and working regularly. And Julie, this is maybe something that you've alluded to with the summer break that takes also roughly 10 weeks or so, or 8 weeks, that some kids come back less prepared of getting into the habit. And that's what we should be concerned about. May I add something to this, or Julie, do you want to add before I continue? Okay, so what we really don't know yet is what has been done in the home. So the data on this is not really out yet. What are the kids spending time on in their homes? And I wanted to show you some statistics that haven't been produced by me, but by Maggie Yu and Jennifer Baxter. Jennifer Baxter is the chief investigator of the Life Course Center, which is an ARC Center of Excellence, and University of Sydney is part of that. I'm going to share my screen now for you. Oh, the host disabled participating screen sharing. So I'm not going to share my screen. Could the host maybe allow me to share my screen?
Di, can we organize that, please? Sorry.
Go on like this, right? I mean, I just thought it would be very illustrative.
If you want to just talk to it, Steffi, that'd be great.
Yeah, so I'm just wondering what's going to happen with all the screen time that these kids are having. So, you know, all these international recommendations from various organizations, among other the World Health Organization says, you know, like younger kids should not have more than 2 hours per day. Oh, I think I'm allowed to do this now. No. And instead, kids should have the ability to play outside and interact with their friends. And this is, you know, we don't know yet what these trade-offs are. What are these kids doing now? So in Australian households, so I know this from the longitudinal study of Australian children by these statistics that Maggie Yu and Jenny Baxter have put together. So I have to look at my own screen now a little bit. So roughly these kids, so 4 to 5 year olds, so these are the preschoolers, okay, who also have stayed at home. They roughly spend 130 minutes per day in front of a screen. So they are beyond already this 2 hour recommendation. 12 to 13 year olds spend roughly 200 minutes in front of the screen, but 6 to 7 year olds, that's quite positive, who have their first and the second year in school, they spend much less, right? They spend about 60 hours per day on 60 minutes per day in front of a screen. And about only 20% spend more than these 2 hours. And on the weekend, of course, this is much higher in all households. But when you look this up by like this education gradient, by those who have some form of university education and those who do not, you see this big gap. So whereas, for instance, kids in highly educated households spend only 12 hours when they're 6 to 7 years old in front of a TV or some screen or playing computer games, it's 25, what am I saying, minutes. I'm just talking minutes.
That's okay. It's hard to,
Yes.
But yeah, so there's that big difference. And we think that during the lockdown, that difference may have been exacerbated.
It's almost twice enough. So kids from less educated backgrounds spend twice as long in front of a TV screen at home at any given time. And so when you think about screen time and the long-term consequences, you could really bring up a lot of horror scenarios. You know, when you look at the psychology literature, you think, oh my God, these kids, like kids who spend 2 to 5 hours per day in front of a screen, you see all these behavioral quirks that they develop, you know, attention deficits, self-regulation deficits. For older kids, when they have more than 5 hours a day, depressive symptoms, suicide ideation, and you could really think, oh my God, this is worrying. So what is happening with the lockdown and the screen time? So this is not really my area of research, so I have not produced any research on this, but we have to see in the next LSEC release of the next wave, what is happening, what have kids done in this time? And
I can tell you from experience, they've watched a lot more TV and they've had a lot more screens. Yeah,
exactly. And it's also like the school now, the online instruction with the schools is proposing this on top of it, right? So these kids are now, like I had a boy as well at home, right? Watching TV much more and also incentivized because now material had to be screened via a tablet. But, you know, the good thing about this is what I can tell you also is most of this research that we know about the negative consequences of the screen time is all an association. So we don't know, is this causally, right? If you causally impose this on a family, will these kids develop this over the long time? And how long does this dose have to be? And then we also need to figure out how much time have kids actually really spent in the home, like doing other things, you know, cooking with their parents and going out and doing exercise. But I think we can continue this discussion when we talk also more about the positive sides of COVID.
Yeah.
Here.
That's fantastic. Thanks, Steffi. And look, we have been joined by Annette. Unfortunately, there's a problem with technology, so she's joining us on the phone. Hello, Annette. How are you?
Hi, Angela. Hello, everyone. I hope you can hear me.
We can hear you very clearly. Thank you for your time today. The question that I really wanted to talk to you about, and especially given your role at the Department of Health, is it's obviously all probably happened very quickly, the setting up of this new body and the coordinating. What was really, I guess, in the mind then about what this was going to mean in terms of children in particular and safety, child safety and their development as you were setting up the sort of the coordination body?
Thanks, Angela. So obviously in Victoria, I think as has happened right across Australia, the response has really been first and foremost led by the public health needs. But at DHHS in Victoria, we obviously provide support for some of the most vulnerable children and families and other Victorians. So as the pandemic was being observed overseas and the planning was starting in earnest in Victoria, we were really focused on how do we maintain continuity of services for vulnerable children and their families. How do we do that through alternative technology if we can, but if not, how do we make the face-to-face interactions as safe for clients and for workers as possible. I think the other thing that we benefited from a little bit in Australia, being slightly behind some of counterparts overseas, is we were also able to see some of the emerging impacts, whether that's around mental health and wellbeing, family violence risk escalating, or other things that may contribute to further harm to children at risk. And we were able to put in some additional planning so we have responses ready to go as and when we may see that in Victoria. We've obviously been fortunate that some of the planning we had in place we haven't had to activate.
Yep.
But I think it's really helped shine a light on, and now as we move into the next stage, and I know a couple of your panellists have talked about this already, that really from our perspective, there are existing vulnerable families where we are concerned about making sure they continue to be connected, continue to be supported, but equally I think starting to turn our mind to who are the families and children who may not be clients of social services, social support systems, but as we move out of the kind of initial public health lockdown response into a longer term economic impact, what does that mean for the environments in those families, the situations those children are facing, and how do we support those people who may not be people who have traditionally utilised more specialised social support. And so things like the work we've done in Victoria about making sure that as we went to homeschooling, there were still schools open for children who couldn't learn effectively at home, and also making sure that children who didn't have access to technology required for remote learning had those provided to them to continue their learning at home where they could do so.
Yeah, that's interesting, isn't it? Because you're right. I think initially it was what's the impact of the lockdown going to have on these, especially vulnerable kids, because suddenly they're going to spend a lot more time at home. And I think, as you know, Julie's alluded to, that creates differences across socioeconomics, but also for the most vulnerable, obviously, even a bigger issue. But the next phase is you're going to have new people who are disadvantaged and potentially vulnerable who weren't before. So sort of, I guess, moving on to that next stage as we sort of all enjoy the easing of restraints, if you like, to the recovery and the dealing with the recession and what this is going to mean for children. This is a less, I guess, novel area of research than what the impact of COVID lockdown is, because obviously we've never had a lockdown like we had previously, and hopefully in Australia we can avoid it again. And I might just go to you again, Annette, just to go off what you've just said. I was going to end with you, but I'll start with you now, which was within that. So you're now starting to plan and to think about, you know, what this new disadvantage looks like. You're also starting to think we learn from COVID in terms of how we undertake business and how we do things, and how that might differ in this recession as opposed to previous recessions. We have, I think, a lot more information than probably we've had before about place-based disadvantage and those sort of things. Is that something the department's starting to look at?
One of the things that's been really quite inspiring as we've worked through the pandemic response so far has been really an example of real-time data collection and analysis and its use in policy making. So not just the public health data, but other data sources that are telling us a deeper and a quicker picture of impact, and how we use that to catalyse collaboration across the traditional policy silos. People may be aware in Victoria, we have actually had changes to the way that government goes around organising itself in this period, with secretaries responsible for particular elements of the response across health, social services and economic impacts, and really trying to make sure that those three domains, and we have an eye on all three right through this next stage, and trying to build on some of the work that Victoria has done previously around place-based work. So we've had some particular investments in greater work on community connections, so leveraging community-based connections. Our testing strategy is now starting to move into how do we target areas of the state with lower testing rates or higher case rates, including how we might use some of the less traditional ways of connecting with community, whether that's through faith-based groups or community groups. So I think there's a lot of that. And as you say, just starting to turn our mind to what might come next, and how we bring the economic and the social support together in place. I think that's happening in a way that we talk about a lot in government, but this has really given us an opportunity to take that to the next level.
It's interesting. So, Julie, most kids now are back at school, and I guess your report today has, really focused on those kids that fell behind, and what we can do to help them, and I guess also maybe even address some of that existing disadvantage, as you noted, which was already there and already significant. Did you just want to run through that report and what you think might be necessary and might work?
One of the great things at the moment in research is that there's a lot of, because this shock has happened at the same time, obviously around the world, there's all researchers all looking at the same issue. And so our report has landed on a number of recommendations that are actually quite similar in terms of what's coming out of the UK and the US. So one of the big findings is that if you look at the evidence around what works best for a range of students, it's actually small group tuition, which is actually not that surprising when you think about it, in terms of the interventions that can happen in the classroom, because it's a bit, in small groups you can target teaching really to that point of need of those particular students. And there's also a social relationship that's a lot more intensive than would happen in a regular classroom. And I think what's exciting now is that there's an opportunity to trial that initiative, because there is actually a lot of fiscal stimulus money going out the door from governments, and small group tuition is really expensive. And so for that reason, it's often overlooked by state treasuries and departments. And in education, there's been much more of a focus on, equipping the teacher to reach all students, which is obviously a lot more cost effective. But really, it's putting a lot of onus on the teacher to try and do everything right. And so this is basically a great opportunity to be trialling something like tutoring. So we're recommending $1 billion be invested in that around the country. Ideally, it will be run over 12 months, but because of the 6-month sort of stimulus chunks that we're going through at the moment, we're recommending it be done by the end of the year. We think it's possible to roll that out well, so long as there's good work done up front by governments to quality assure some of the providers that might be involved. So that's the guts really of our recommendations. We're obviously also suggesting, I think, a number of social supports also be put in place in schools. One thing is around teacher training in mental health literacy, so that they can better spot students who may be struggling more than normal in the classroom, to recommend them to the services that they might need. There seems to be big gains that could easily be had there from some pretty straightforward training that we know is an existing issue. as well as behavioural supports in schools. So just giving that are one-on-one and more intensive, and again, more expensive, and for that reason, often not trialled. But the evidence base in education is still evolving. So those, even what training to give teachers, just there hasn't been seen to be a lot of positive effects from that. So we're recommending that those things be trialled on a smaller scale compared to tutoring.
So Steffi, you mentioned before about, you know, the importance of attendance and early attendance and those sort of, do we know what the mechanism is, and does it matter what is happening at school, or is it any attendance is good, or is what Julie's talking about in terms of the services that we're offering at school important to child development as well? If you just unmute, sorry.
So this is a little bit of a tricky question. It depends on where you look at. So my statistics were now coming from very remote areas in the Northern Territory. I'm talking here about Aboriginal community where there is less a culture of going to Western, or an acceptance of going to Western cultured education. I don't think this is what I'm saying here is representative for the rest of the Australian population. And the deterrents or the factors that hold kids back to attend school are very different than in other aspects. We should also understand that, you know, school attendance rates are almost 100% in the rest of Australia, yeah, relative to these remote areas, like 92%. I mean, kids usually miss out on school because of kind of good reasons, or of legitimate reasons, what the school considers as legitimate reasons, of excuses, so being sick or going to a family funeral or so. And this is very different in these remote areas. So in these remote areas where there's no strong culture and attachment to the Western-oriented school system, you know, you have to come with heavier dosage to support these children. So what's being done in the Northern Territories, for instance, you bring like mobile preschools to these communities, which has been very successful in bringing relevant education into these localities. The other factors, so I may move away a little bit from this case, because I would also like to say something that is more representative for the rest of Australia, or for other, let's say, OECD nations. For those who don't know, the OECD is like this club of the richest countries in the world that includes today also Mexico and South Korea and others. And when you look at such countries, you know, we always talk about the socioeconomic disadvantage, and someone here, a participant in the QA, asked me, what do you really mean by a disadvantaged student, and what type of support are we targeting? And traditionally, so the answer to the person is we would have some formal statistics what a disadvantaged person is. So you would say someone who lives below a defined poverty line, okay? Or so according to this, roughly 17.8% in Australian kids are poor and would be extremely disadvantaged. So relatively high numbers, so you shouldn't get carried away with this, is mainly because of the housing situation, Australia, overcrowding, that drives this number. But you could also, what very often institutions use, and maybe Julie and Anne can correct me on this, is in which postcode you're living, right? Which postcodes are considered as disadvantaged according to some criteria that the ABS is defining. You could also define, and I think Anne has mentioned that before, children at risk. And I think I personally would like to talk more about these children, because, and I tell you in a second what we actually mean by this, children at risk. But when you think about, you know, when you look at nationally representative data, or almost nationally representative, like the LSEC, the Longitudinal Study of Australian Children, where we have most of the information about in Australia, what kids do in the home and what they experience. And, you know, when you look at the data, you look at the investments that families make with their kids, there are socioeconomic gradients by education and in income backgrounds. But, you know, even poor families invest a lot in their kids. Yeah. Like they do a lot of cool stuff, right? And when you graph this, so I've done this in some of my research, you see that apart from the reading every day, you almost see no socioeconomic gradient in all these activities, you know, going to the games, going to the library, going to a music event and so on. The only thing where you really see the strong socioeconomic gradient is that better educated parents are 3 times more likely, I'm exaggerating, 2 times more likely to the kid every day.
Yeah. Okay.
It's more likely. And that's the only difference. So I don't really think that disadvantaged kids per se are not fit for the future, right? So my own research, very recently published in the Journal of Population Economics, has shown that the single most important predictor of later life human capital development is whether your parents, especially your father, was engaged in your schooling. That's teacher assessed. When you're like 10 years old, when you follow up these kids into their 40s, you see that kids who have had a father who was very involved in their schooling, they call this parental engagement with the schooling system, then you develop non-cognitive abilities that are associated with economic success later in life and with a better health outcome.
So father, not mother, because that's traditionally we think, yeah.
Yeah, I mean, this is from a cohort study from the UK, which is maybe similar to our system in Australia. And these kids were born in 1970. And when you look at the data, is like women most likely were engaged with the school. There were some outliers, but it was so common in the 70s and in the early 80s for the mothers to do this. And they had very special fathers when they were engaged. And you see a socioeconomic gradient in this. Again, it's always like this ×2 rule. Fathers in highly educated families were twice as likely to do this, but there were lots of fathers who did this too in like manual occupations. And that is quite intriguing. So now I would like to come back to this point about what do we mean by a disadvantaged child. And it comes back to what Anne had been talking about, these children at risk. Children at risk are children who are at risk of harm or at risk of severe harm in their households, of either neglect, meaning that their basic needs are not being taken care of, like coming showered, to school, like in proper clothes, having had breakfast, and getting emotional responses for their parents, or children who are at the risk of being abused, either physically or verbally, emotionally, or physically, sexually abused. But let's talk not about the latter part, because this is a very tricky thing to figure out in which families this really happens. And it's these children that are, due to the lockdown, and then on top of a looming recession, are more at risk of being harmed and falling behind. And in Australia, there's roughly three in 1,000 kids enter the child protection system in one way, or enter it, not only having notifications, but enter it where it's being followed up. And the question is, what is going to happen to this number? Roughly 12,000 kids who have had a substantiated case of being at risk by a court. That's first established by a caseworker in the child protection system, and then a court decides what's happening. Roughly 12,000 of these are, for instance, established to have been neglected. So there is some research by Elizabeth de Cauw, it's LSE in the UK, London School of Economics and Political Science, and she figured out with US data that if, in a recession, like if unemployment goes up by 1 percentage points, neglect cases go up, substantiated neglect cases go up by roughly 20%. So what this means in our case is we're going to probably go up at least by 1 percentage point in unemployment. So a 20% increase roughly of this 12,000 kids. What would this be? Like 2,500 kids extra. And when you then think, what does this do to disadvantage in the long run? Well, I've done my own research on this again with the UK data. I was a cohort born in 1958. If you were neglected in childhood, somewhere around until age 11, your wages, earnings pre-retirement are going to be almost 25% lower for kids that haven't been. So these are the economic magnitudes. And Julie, I would like to come back what you had said before about these learning losses, like a month falling behind, 2 months falling behind. I don't think that these will have these economic impacts. I actually don't think we know the number, falling behind in school by that amount. What does this do 50 years later? But we know it for these at-risk kids now. Now we have these numbers out there. And I think that's what we should be worrying about, and put all of our, fiscal stimulus should go into services targeting these at-risk kids.
I guess the problem, Steffi, is that that learning loss is across everybody, whereas the disadvantage is quite narrowly focused, which, you know, might mean that, yes, it's only a month, but if everybody's experienced that, it becomes quite significant. But I pick up on your point, and I'll go back to Annette, because this is exactly where you're working, obviously, Annette, and this sort of idea that, you know, it'd be nice to think we only have a 1% increase in unemployment. I hate to say it, but I think we're headed for something a lot higher than that. And what that's going to mean for disadvantage and those really at-risk kids. And what we can do now to try and, I guess, mitigate those impacts, and what the government is doing now to try and mitigate some of those impacts.
Yeah, and I think the other thing that's interesting when we look at predictions for the recession that's coming now, as opposed to perhaps previous recessions, is the emerging sense of women being particularly impacted in terms of reduced unemployment or reduction of hours. And I think the two combined mean looking potentially at you know, significant impact in children at risk, but also the settings that allow for economic security in that family, for parents and mothers to work, the complicating factor of, if we move back to early childhood settings and childcare settings that are predicated on having a job before you access childcare, rather than thinking of that as life schooling, a universal platform that allows not only children's development, but connection for families at risk, to connect them with services prior to or in support of steps that can be taken before child protection involvement. I think, as I said before, keeping those children engaged in school or in community is really critical. And I think the work that we've done previously to have particular settings to keep those children connected. And then I think it really is about how we bring services to those families through the next period, as well as supporting the likely intake in demand. I think we know that where we have families, there's emerging evidence that working with them intensively can be more effective than using some of the statutory and legislative responses, but the need for really quite intensive work with families to support them in terms of parenting skills, in terms of connection to employment and connection to broader community.
That's interesting. And I think one of the other things that it's been raised with me, especially for those in, I guess, year 11 or 12, is that, and this sort of goes to Julie's point around falling behind. If you fall a month or 2 months behind, then your likelihood of re-engagement might be less, because you think, well, what's the point? I can't catch up. And then all those other problems probably flow on, because if kids feel like they've been left behind and there isn't that support to catch up, then those other social impacts might be exacerbated. So, Steffi, in terms of, I think we've talked about what the problems are and those sort of long-term impacts, which are clearly, you know, catastrophic for a lot of those people impacted. In terms of the evidence about what policy interventions work, did you want to talk a bit about that, about what does work or what doesn't work, and how, you know, Annette sort of indicated what they're looking at and this sort of more case management approach. Is that the right way? Is there evidence of other mechanisms? I know in previous recessions where sort of income support's been maintained, that's helped, but are there other interventions that you can allude to?
I mean, do we have like 5 hours of time?
Yeah, well, we've got 20 minutes left.
Look, we haven't really ever been in a situation like this where we have this combination of a social isolation measure with a looming recession. So I would kind of like, I don't really like to lead myself out of the window and say what will help mitigate this. But what I do think is that we may use this as an opportunity to think about two things that I would like to get across. One thing is how do we actually get good mental health services out? that can be accessed also if we are in isolation. Just imagine there's a second wave, right, of the virus. We have to lock down again. Beijing is currently under lockdown again. All right, so we may experience this again. So how can we bring services out, like for immediate care? Because this is also, and Anne can probably comment to this too, because during the lockdown, all these services that were provided, like, you know, for mental health issues and addiction services, and from child protection workers couldn't go to the homes. Like, how do we administer services under lockdown scenario? Second, I've been thinking, because Angela, you had me ask me beforehand of what are like international examples, historic examples where we had such a lockdown, and I can't really think of anything in the times, because the time when we go back to the 1918 flu, everything was very different at the time. We can talk about the so-called Spanish flu, which I'd rather refer to the 1918 flu as a correct term. We can talk about what we know in the literature about that as well, but it's not really comparable because it was end of World War I, and, you know, so many people have died and from World War I alone. But so what happens in the future if we don't manage to get into a low carbon emission economy, and if we don't manage to get these extreme heat waves down? So when you look at the data on these extreme weather events, then you see that, like, in the 1950s, we had hardly any of these extreme weather events. But now, today, since 2010, we have at least every year 12 to 15 of those. And if this continues in the future, does this mean that we lose more school days because the kids will have to stay home in school? So you see this in the US when cyclones hit, or when they have these extreme cold snow days that the Northeast is just not being accustomed to in the United States, then these kids may be out of school for a week or 2 weeks. So let's assume this happens. So this means we may need to get services that can be accessed in one way or the other via apps, or Zoom, you know, that doctors can provide services via Zoom. I think that is an area of investment where you need really government and research going together. How do you, like, there is of course telemedicine already that exists in other countries, especially in remote areas. Can we administer like psychological help services via Zoom? Is that possible? Is this effective? I don't know, but we have to think about this. And the second thing I was thinking about is, you know, when we talk like these family home visiting partnerships, you know, some of you may have heard of David Olds, like these family nurse partnerships that have been used to really go into families and support families. They're quite expensive. So the question is does the government want to make a commitment to do this? I think we spend currently 0.3% of GDP on child protection services. That is maybe half of what the OECD average is doing. So Australia spends relatively little in, you know, when you look at the larger picture, but should we amp up these services by default? So not only in a crisis, but should we double it? And should we make family home visiting partnerships kind of universal? This is a discourse that should be had in, you know, at the highest policy level in Prime Minister and Cabinet or in the Treasury, that you're not confronted at this time like at a crisis where you can't implement extra services, but it's just standard. And then, so we know from the literature quite a lot that this is very effective in helping, you know, those living life at the bottom. And then I've been thinking a lot about mental health services. We have to really think about this, how to bring mental health services, especially for young people who are so dependent on the goodwill of their parents and the, you know, the care of the parents. How can we administer mental health services beyond headspace, okay, that are very effective? And there is some evidence in the international literature that if you bring this into the school system, something like cognitive behavioral therapy can be extremely cost effective and very in terms of reducing the risk of high-risk kids to end up in jail or to abuse substances. So the Chicago public school system has trialed cognitive behavioral therapy in some of their public schools in the South with kids that are with one leg already in jail. And if you spend something like $1,200 on one kid, you can halve the probability of ending up in jail at age 16. And, you know, I'm exaggerating now, like we don't have this type of disadvantage in Australia. So you know, some of you may say, oh, it's just ludicrous, but take this as a principle. Why not running such services in the school system so that kids who need them are flagged earlier and can be treated earlier? And this intervention was relatively cheap and effective. So that's what I would like to put on the table, because such interventions work.
Annette, would you like to accept a doubling of funding?
Yeah, I mean, I'm happy to, like, I put this on the table. I'm happy to pay higher taxes for this to work.
No.
But you know,
I'm just
to
saying, I'm sure
reshuffle fiscal spending, like away from, like there needs to be, probably someone will shut me up in a second. Higher taxes, no, but like, you know, the spending, if you want to build the skills of the future, you have to kind of change your spending priority.
So we've just had some questions on Q&A. One is about the impacts, particularly on students with a disability. So we've sort of talked about disadvantage from a socioeconomic perspective, but obviously there's different types of disadvantage. Julie, is there any sort of information, you know, that you can, in terms of the way, I guess, our school system treats or is currently dealing with kids with disability and how that's been affected by COVID-19?
Yeah, sure. Actually, our work hasn't looked at that particular issue, but just anecdotally, it's a very big area. I mean, there's a lot of students that rely on an aide in the classroom, and that support typically hasn't been there during remote learning. And so you hear stories of the families really struggling during that period to give their children everything that they need. So it's a big area, and I think there'll need to be quite specialised solutions. So yeah, that's a huge area that also needs urgent attention.
Okay, so we've focused a lot on the negatives, which is what I envisaged, and the negatives are obviously great, but the lockdown, you know, can have positives, maybe not the recession so much, but the lockdown itself. So maybe if we end the discussion just talking about some of those and what the long-term benefits might be to this generation of kids, you know, from having experienced COVID-19. Steffi, I might start with you again, and then I'll jump to Julie and then to Annette to finish off. Thank you.
Okay, I'll just keep this very short because I've had quite a disproportionate amount of time already. But I think there are positives around this. If you think of those, I mean, those families where parents now had to work from home and spend more time in the home where the children and had to spend less time commuting. We have had less air pollution, less noise pollution, more time with your kids. This must have benefits as well. These kids are learning in the home, having more attachment to their families in terms of being taught at home. You as a parent start appreciating more the work of what the teachers are doing, and you see how your kids learn and where their strengths and weaknesses are. I think this is quite important for the family relationships, assuming that, you know, this is a not high risk family. You know, you cook together, you know, like we know in recessions that deaths in land transport go down. It's quite significant and quite consistently across all different countries. We've done it just as research in Australia, hopefully forthcoming soon. You see that. So accidents are reduced. Parents spend, 2 hours less in the car. If they have a garden or somewhere outside to exercise, these kids are going to exercise with their parents during the day. I think that there are positives about it, and you spend more time in watching maybe something together and reading books together. Yeah, I think there must be long-term positives of being more attached to your children and their children more attached to you. I don't want to take up more time, but there are better family relationships due to more time must have benefits in the long run. Okay.
That's great. And Julie, in terms of the education, and I know we've focused on the learning losses, but there has been it's been good for some kids, is sort of the indication that maybe some kids who struggle to concentrate in the classroom or or maybe suffer bullying at school have found it a positive. Is that something that's coming through the research as well, that while some people they might be learning less, some people are learning more?
Yeah, definitely. I think there's been varied experiences, and some children will have had more positive experiences. I think one of the big benefits has been around independent learning. So students, and we know that metacognition and those skills, so students setting their own tasks and being able to regulate themselves working towards those tasks is a really key skill. So there have been benefits there. I think I'd echo a lot of what Stefanie just said around appreciating teachers. I think a lot of students will have appreciated that their parents don't necessarily know all the answers and how valuable their teachers are. And also I think the other positive out of this is just, I think there's a lot of kids who realise how much they miss school. And actually that's, you know, I think we have a bit of apathy in Australia towards school and the education system, and I think hopefully this has revitalised that a little bit. And I just thought maybe just to tie off a little bit on what Stefanie raised, and I completely agree in terms of, I think there's a need for more investments in, you know, the children who are particularly at risk of far more sort of serious, I think, emotionally damaging issues and sort of missing, you know, 1 to 2 months worth of learning. Just to be really clear, we're suggesting that our learning issues be targeted at the bottom, at sort of students who are experiencing disadvantage, and often there's a lot of overlap, I would think, in that group of at-risk students at home for other reasons, and that often shows up in schoolwork. And I think the second thing is just to go off what I was saying about the social interactions. I think that, you know, that is something that schools do offer kids. And if we're thinking about how do we try and identify kids who are having mental health problems, you know, teachers spend 8 hours a day with students, as you've said. So there's a big opportunity there for mental health in schools, and just really sounding the alarm bell when something's wrong.
And Annette, I know, so in one of my other roles, I'm on the board at Royal Melbourne Hospital, and we've seen a big decline in emergency department presentations, which is partly around accidents, but it's also around drug use and at-risk behaviour. I was just wondering, in terms of the department and service use, you know, has there been this increase in demand, or is it that there might be less risky behaviour going on, particularly during the lockdown? That might change now. You know, have there been positives? I
think they've definitely been positive. I'm not sure, Angela, if you could draw the link in the data yet about whether the hospital admissions have decreased or are perhaps deferred. I think that's still to be done. I mean, I think the two things I'd say, I think the technology though, and kind of getting a quantum leap in terms of how we use technology to deliver services and supplement social interaction rather than seeing it as a kind of either or, I think has definitely changed. The other one, just to throw in the last few minutes, I think the positive is, if it can sound perhaps a little bit radical, I think it's pushed us to really think about the difference between the kind of personal and household space and the public space. And I think so much of our policy settings still drive a lot of thought from people as individuals, and that the household and the family is somehow not an economic space. And I think one of the things of the mass lockdown, I think, has been really upsetting that dichotomy. And I think that's actually going to be a really exciting space as we work through that in terms of social change and policy change going forward.
Yeah, it has definitely changed our perspectives, hasn't it? Both on what disadvantage is, about where it comes from, and what the role of society is. Look, thank you so much for today's discussion, and I'm sorry, Annette, about the IT issues. You've really persevered there incredibly well. Thank you to everyone who's joined us today, and we look forward to you joining us again tomorrow for your lunch when we look at the macroeconomic outlook. And thank you very much. Please stay healthy, everyone, and stay safe. And thank you for joining us today.